Good day. We'd like to talk about an important aspect of healthcare that combines faith and healing within our community. It's called the faith community nursing, also known as parish nursing or congregational nursing. Faith community nursing is a specialized form of nursing practice that recognizes the profound connection between our physical well-being, emotional health.
So our topic for today is faith community nursing. So faith community's role in health and wellness. The importance of the faith communities for American, what is Charles Mosque and Temple work together to improve the health of their communities. A faith group adapt one small area and made sure that every single child was immunized. For example, is throughout the communities. Me provided care the indigent. Like example is human needs. So, mag-provide kag mga food, clothing, and basic health care. Majority of the population belong to organized faith communities. Approximately one-third of people in the world identify themselves. So, example is the Islam, Christian, and Buddhism. So, lahi-lahi og pamaraan. So, lahi og aspekto, iba-iba og rituals related to health healing, specific include and prayer. So, next is positive correlation between religion and health that has recently been termed the faith factor. This research found that there was an inverse relationship between religiosity and depressed. So, example, ano religion? So, ang religion kay provide things that are good for health and well-being, included ang social support. Essential meaning to sense of purpose of coherent belief, religion, moral code. So, ang depressed naman is kana bitaw mga tao nga gikan og depressed, then before pa nila nahila ng God, dito na dayon sila gabago. So, mag-attend na sila, magsimba na sila, then follow the teaching of the Bible. Next, organized religions are attempting to meet the needs of members in many non-traditional ways, such as exploring internet charge and service, developing support and group, and including modern music and drama and traditional worship of service and improve integration communication.
So the next topic is the foundation of faith community nursing. So Granger Westbridge, a Lutheran minister, is considered a founder of the modern faith community nursing movement. So Westbridge was a visionary with an understanding of possibilities that church leaders, healthcare providers, professionals, and congregational members could make in improving whole person health, the body, mind, spirit. In one sermon, he noted that church has not assumed its share of the responsibility for the health of the community. He later proposed the W.K. Kellogg Foundation and the Department of Preventive Medicine in the University of Chicago College of Medicine, the founding of holistic health centers where family physicians provided primary health care in churches with a team of nurses and clergy. In 1948, he proposed a parish nurse program to Lutheran General Hospital in Chicago. Westbridge envisioned a partnership between the hospital and all churches, congregations in the hospital community. He proposed that participating churches would make contribution to fund a nurse's salary and identified 7 roles the nurse could use to provide services to faith communities. So Larry Twaddell and McDermott 1999 and Westbridge in 1990 described the philosophical basis of parish nursing is as encompassing the following five key elements. So the first is the spiritual dimension is central to the practice. So this means that the faith community nursing, the recognition and incorporation of the spiritual aspect of individuals' lives is fundamental and essential. It acknowledges the spirituality plays a significant role in health and healing. So the second aspect is the role balances nursing, science, and technology with service and spiritual care. So this means that faith community nurses incorporate both scientific and technological aspect of nursing practice as well as the provision of service-oriented care and spiritual support. On one hand, faith community nurses possess knowledge and expertise in nursing science, which includes evidence-based practices, healthcare assessments, disease management, and health promotion strategies. They stay updated with the latest advancement in healthcare technology and utilize it to enhance their clinical practice. So this scientific aspect of the role enables them to provide competent and effective nursing care to the individuals within the faith community. On the other hand, faith community nursing is deeply rooted in the principles of service and spiritual care. They serve as a compassionate caregiver, offering support, comfort, and advocacy to individuals and families. They recognize the spiritual dimension of health and healing and provide spiritual care that aligns with the belief and values of the faith community they serve. This can involve providing spiritual guidance, facilitating prayer or religious rituals, and creating a nurturing environment that supports individual spiritual well-being. The third aspect is the nurses' clients are a member of the faith community defined by the church and its public service philosophy. This means that in faith community nursing, the primary recipient of care are individuals who are part of a specific faith community or congregation, as defined by the church or religious organization, and its public service philosophy. The fourth aspect is the parish nursing services are built upon principle of self-care and capacity building with a focus on understanding the connection between health and the individual's relationship with God, faith, tradition, nursing, and the broader society. This means that in parish nursing, there is an emphasis on empowering individuals to take care of their own health and well-being while recognizing the interconnectedness of their relationship with God, their faith tradition, nursing, and the broader society. So the last aspect is the fifth aspect, which is the parish nurse understands that holistic health is the dynamic process that requires connection among the person's spiritual, psychological, physical, and social dimension. This means that in a parish nursing, there is a recognition that health is not solely determined by the physical well-being, but it is multifaceted concept that encompasses the spiritual, psychological, physical, and social aspect of a person's life. The parish nurse understands that these dimensions are interconnected and influence each other. These beliefs direct the parish nurse in planning nursing care and defining health not only as wellness but also a wholeness of body and spirit. They also emphasize spiritual health as a motivating factor in seeking wellness care, participating in education, and enhancing self-care capabilities.
Hello everyone, I'm Dayan Manet Abenes and I will be discussing about the roles or functions of a faith community nursing. So it says here that the faith community nursing practice focuses on health promotion and wellness. It is based on a holistic nursing practice that holds the spiritual dimension central to health and healing within the context of a faith community. So, faith community nursing, they are also known as church nursing or parish nursing. So, the faith community nursing, it is a specialized field of nursing that integrates the principles of holistic healthcare with spiritual care within the context of a faith community. The FCN improves the health of a faith community by implementing interrelated roles or functions, which includes the health educator, the personal health counselor, referral agents, health advocate, coordinator of volunteers, developer of support groups, and integrator of health and healing. So there are 7 roles or functions sa FCN or Faith Community Nursing. So ang first role or function is health educator. So the FCN provides or coordinates educational offerings for people of all ages and developmental stages. So as a health counselor, the educational efforts may target the lifestyles, values, and wellness of each individual within the congregation. So, the educator role also includes promoting health literacy, and they also involve empowering individuals to understand and navigate health information, make informed decisions about their health, and communicate effectively with healthcare providers. So, examples of educational efforts are teaching cardiopulmonary resuscitation or CPR to new mothers, teaching signs and symptoms of hypertension and stroke to adults in the congregation, educating lay church ministers visiting homebound individuals on the signs and symptoms of acute illnesses, and lastly, teaching basic health and safety to school-aged children. The next role or function is the personal health counselor. The FCN discusses health problems with individuals and families within the church community. So, as a personal health counselor, the FCN and the client or the individual will have a one-on-one interaction, which allows the nurse to provide personalized support, guidance, and education to address the unique health needs of community members. So through personal health counselor, the FCN must establish rapport to the individual, enable for the individual to feel comfortable discussing about their health concerns. So the nurse engages in conversations with individuals and families to identify and discuss their health problems. So this may involve exploring the current health issues of the individual, understanding symptoms, and assessing the impact of health conditions on the individual's overall well-being. Next role or function is the referral agents. The FCN utilizes referral skills and knowledge of community resources to guide individuals as they access available resources. So, the FCNs are equipped with knowledge about local community resources, services, and healthcare providers. They use this knowledge to guide individuals in accessing the appropriate resources to meet their specific needs. So, the role of the FCN as referral agents, they may also function as liaison. The FCN acts as a liaison between individuals and the various resources available in the community. This involves understanding the unique needs of individuals and connecting them with relevant services, support groups, financial assistance programs, or healthcare providers. The individuals living with complicated chronic or catastrophic illnesses often require comprehensive support, so the FCN as a referral agent, which can also function as liaison, they can help these individuals to understand and to learn more about their illnesses. Next is the health advocate. The FCN facilitates clients' efforts in obtaining needed health services and appropriate care management plans, promotes community awareness of significant health problems, lobbies for beneficial public policy, and stimulates supportive action for health. Health advocates focus on promoting preventive measures to reduce the incidence of health problems within the faith community. This may include advocating for regular health screenings, vaccinations, and lifestyle modifications that contribute to overall well-being. Next is the coordinator of volunteers. Involves recruiting, training, and directing volunteers to work with the faith community nursing program or health ministry. So this role involves overseeing the recruitment, training, and direction of volunteers who contribute to the success of health-related initiatives within the community. The FCN, as a coordinator of volunteers, may identify and recruit individuals within the faith community who are interested in contributing their time and skills to support health-related initiatives. They may also provide training sessions to equip volunteers with the necessary knowledge and skills, ensuring they understand their roles and responsibilities as FCN or Faith Community Nursing. Okay, next is developer of support groups. So this requires skills in assessment, and the FCN uses community assessment and program evaluation skills. So this role requires skills in assessment and program evaluation. So whether the community is rich in resources or has limited health-related resources, the nurse works to establish supportive environments where individuals can share their experiences and find common solutions. So they conduct assessments within the faith community to identify prevalent health and wellness needs. Some individuals prefer support groups to be physically located within their faith community, where they have existing support systems and can network with individuals who have common values and beliefs. The FCN must evaluate the need for a support or self-help group within the faith community. Situations that might indicate the need for support groups includes the increased incidence of a sudden and shared experience by members. For example, the death of 5 or more members from cancer in a short time frame, several incidences of suicide or eating disorders within a teen group. The last role or function of the FCN is the integrator of health and healing. The nurse acknowledges and integrates spirituality as the basis of his or her nursing practice. For example, in teaching a class on healthy aging, the nurse will discuss lifestyle, compliance with prescribed medical treatment, attitudes, and values and their connections to well-being. In a home visit to a terminally ill person, the nurse will explore the meaning of healing versus cure and provide emotional support and encouragement. So as an integrator of health and healing, the faith community nurses places spirituality at the core of their nursing practice. So that is all for my part.
Education of the Faith Community Nurse. A baccalaureate prepared RN with several years of experience in clinical practice is the best prepared to implement the rules of the FCN. However, many schools of nursing provide the faith community education in baccalaureate, pre-licensure, RN to Bachelor of Science in Nursing, and MNS, Master of Science in Nursing program. So many universities are incorporating existing basic preparation program into advanced nursing degree programs. So programs are generally offered at beginning and advanced level and consist of approximately 32 to 40 content hours of planned classroom instructions. So self-study or clinical experiences at each level. So implementation of the FCN rules requires the use of the nursing process to plan nursing intervention is wellness and physical, emotional, and spiritual health. So, suggested core curriculum content for beginning parish nursing program. So, we have spiritually, history, and philosophy of the faith community nursing, self-care, healing, and wholeness, professionalism, ethical issues, documenting practice, legal issues, beginning at the faith community nursing, ministry, and the lastly is the communication and collaboration. So, holistic care, health promotion, transforming life issues, family violence, suffering, loss, or grief. In the community, we have assessment, resources, advocacy, care, coordination. That's all.
The faith community nurse and spirituality and issues in faith community nurse practice. So, Westberg 2007 described the ideal of FCN and who is spiritually mature and be able to apply spiritual aspects to the healthcare of congregation's member. Many FCNs need further education to develop spiritual assessment skills, acquire theological knowledge, and learn to nurses' roles in healing. So, Anna Putzi Wright, 2005, defines spirituality as the human desire for a sense of meaning, purpose, connection, and fulfillment through intimate relationships and life experience. So, in nursing, spiritual distress is more often the focus of care. So, circle model of spiritual care. So, this model illustrates the following concepts of a care that guide nursing practice and interventions. So, circle. So, C is for caring, I is for intuition, R is for respect for religious beliefs and practices, C is caution, L is listening, E is emotional support. So, what is caring? So, caring includes practices and attitudes. So, Swanson, 1991, provided an understanding of the caring processes through her early research, so which identified 5 caring processes. Knowing, trying to understand what events mean to the patients, being with or both emotionally in person, doing for or as needed, and enabling, helping through transitions and life stages. And lastly is the maintaining. So, maintaining belief or helping the person sustain faith or hope. The next is issues in faith community nurse practices. So, the practice of faith community nursing is affected by many issues common to community health practice as well as issues specific to parish nursing. So, selected issues discussed in the section include working with vulnerable populations and the legal and ethical issues of confidentiality and accountability. So, providing care to vulnerable populations. So, the philosophical foundation of faith communities related to caring, outreach, and support of vulnerable populations places to parish nurse in a position to positively influence the health of diverse groups. So, historically, churches manggod ang have among the first groups na mo sponsor and also to support refugees, develop programs for homeless individuals and families. So, after assistance and resources to low-income influence or low-income families, and provide resources to entire communities during disasters like floods and tornadoes. So, next is the end of life issues, grief and loss. So, faith communities have long been the first-time provider of support related to loss, grief, and dying. So, the aging population, the increased prevalence of chronic disease such as cardiovascular disease and cancer, and public awareness have contributed to the need for improved end-of-life care. family violence prevention. So education and prevention of family violence directly relate to Healthy People 2020 objectives. So and all nurses must be informed in this area. And nursing interventions for suspected or actual child abuse include the following. So first is report the appropriate authority. Two is provide resources and referrals. Three is establish trusting relationship with the child or adolescents. Four is provide presence. Five is listen. And lastly is document according to policy, law, or both. So, levels of prevention. So, the roles of FCN, direct interventions and program plan for faith communities. The following are examples of all three levels of preventions applied to this case study. So, first is primary. So, primary, second is secondary, and lastly is tertiary. So, primary, the assessment and teaching about parenting health and wellness. So, developing of programs and social support systems to prevent social isolation and increase resources for successful parenting and healthy behaviors. Secondary, so the FCN assessment and screening to identify individuals and families at risk, congregational resources and educational programs developed to meet individual and family needs. Lastly is the tertiary, so FCN providers or refers to resources for rehabilitations for families coping with children with disabilities or chronic health problems, parents and children.